I'm Susan Gerard, and I'm the President and CEO of the Mississippi Children's Museum. We are so grateful to all the children around our state who have sent us their questions, who've either called us or sent us a video of their questions, and Dr. Didion is here today to answer those questions.
Well, thank you, Susan, for inviting me, and I'm so very excited to be here answering these questions at the Children's Museum. And my name is Lisa Didion. I'm a pediatric hospitalist and the Associate Chief Medical Officer at Children's of Mississippi, which is part of University of Mississippi Medical Center.
So let's get started.
Well, I'm Sebastian, and I'm 5, and I'm from Madison, Mississippi. I know viruses mutate, but where do they actually come from?
Great question, Sebastian. And viruses are just part of the world we live in. I can't tell you exactly how they started or where they started, but they are everywhere. This particular virus is a new one. It is new to us as humans because this virus typically lives in animals. And very, very rarely a virus that lives in animals can infect humans. And that's what makes this virus so unique.
What do you want to ask?
I don't need to wash my hands.
Excellent question, Annabelle. And this question is so important because it is the most important thing we can do to protect ourselves from this virus. Our hands touch everything. They touch objects, they touch our food, and then most importantly, they touch our face. Sometimes we rub our nose, sometimes we rub our eyes. But when we touch things, we get germs on our hands. And we don't want those germs in our mouth, in our eyes, or our nose. So it's really important to wash our hands to remove those germs. Then our hands are nice and clean, and we are less likely to get germs on our face. When germs get on our face, they're more likely to cause infection.
Hi, my name is Susanna. I'm from Ashland, and I'm in the 4th grade. I have a question. Why did the coronavirus happen in the first place? How does the coronavirus spread?
Thanks, Susanna. Thanks for the great questions. So I'm going to actually answer the second question first of why did the coronavirus happen in the first place? And it kind of goes back to Sebastian's question of how did it start? So for some reason this virus, which is normally in animals, infected a human. And once it infected a human, then it was very easy for us to spread it to each other. And this virus spreads very, very easily, which is why so many people have gotten sick. The virus spreads primarily through coughs and sneezes. So that's why it's really important when you cough that you cough into your elbow or you sneeze into your elbow and you wash your hands frequently. Sometimes they think the virus may spread on objects as well. So maybe the virus is on a table or on a cup. And that's another reason why we're asking people to wash their hands, because if they touch the cup and then touch their face, they could give themselves the virus. But primarily through respiratory, meaning through when you cough or when you sneeze.
My name is Henry Howell, and I'm 8 years old, and I want to know how the coronavirus came here and just appeared here, and how does it spread so fast?
Well, this virus spreads very quickly because we as humans, we like to socialize. We like to be together. That's part of human nature. That's what makes life so fun. As children, we like to go out and play, we like to go to school, and we like to be close to our family and friends. And so that's why this virus spreads so quickly. And that is why we're really trying to work hard to distance ourselves from family and friends, even though that's not very much fun. But it's really important because we know that that's going to prevent the spread of the virus.
Lily, who is from Jackson, Mississippi, who's age 8, she wants to know, why do we need to stay 6 feet away from other people, and where did that number come from?
Great question, Lily. You've been paying close attention to what scientists are asking us to do. And 6 feet is important for a couple of reasons. Number one, we talked about coughing and sneezing. When we cough or sneeze, little tiny particles of water or mist go into the air. You can't even see them. They're so tiny. And those particles can travel about 6 feet. Sometimes those particles travel even when we're talking. So right now when I'm speaking, some particles respiratory particles get into the air. We can't see it. But we know that they don't travel much further than 6 feet. So that's where that 6 feet number comes from. It's less likely that we can spread the virus that way.
My question is, have they found a vaccine for the virus? And if not, what is being done to find one? And who is finding one?
Thanks for the question, Malik. So unfortunately, there's not a vaccine yet, but we are really hopeful that we'll have one soon. There are scientists all over the world working on this. Just like you're asking these good questions, so are they. Remember, every good discovery and every good invention comes from a question. So they are asking the same questions. We're really hopeful we're going to have something within the next year.